there, and welcome to the Reflection Show. We are still in our 3rd anniversary celebration mode. The Reflection Show is 3 years. If you missed our other episodes where we spoke about our 3rd anniversary and how far that we have come, today we want to focus on how our kids, our younger siblings, can take care of their eyes, and how we parents and adult, anytime I say we parents, I'm not a parent yet, but how guidance and parents can monitor to be sure that, or to observe certain symptoms to be sure that this can maybe grow into become something that can affect the child's eye. So today we want parents to pay attention to this conversation, because sometimes you see the child scratching the eye, the child sitting far away from the TV or too close to the TV. These can all be symptoms that we can observe so that we can prevent blindness or maybe severe eye complications among our children. So it's an episode that you don't have to miss. Stay tuned. We'll be right back. I'm Arthur Spice.
My name is Naima. I have a challenge with my eye since I was in basic 5. If I'm in class learning on the board, it reflects, so I can't see well, I can't read well, so I have a problem with learning. So when I heard about the eye screen in Matter Research Foundation, I decided to come over and see how it will help me, and I'm very happy to be here today.
Welcome back. I'll be speaking with Dr. Daniel Opoku Jemfi. He is principal optometrist at Savannah Opticals and Eye Care here in Tamale, making sure that all our eye needs are being met. And if you've seen some of our videos where we had the free eye screening, you saw the videos that we said we partnered with Savannah Opticals. He's been one of the great support to the Martha Inspires Foundation and the Reflection Show. And then when I kept mentioning Dr. Daniel on our episode on our 3rd anniversary, this is the man I was talking about, who provided free eye care services to our kids that come to the reading clinic. Dr. Danny, welcome to the show.
Thank you for having me.
First time having you this year, right? This year, okay.
The last time was in December.
Oh, yes, it was in December, and now we have it in 2024. Great. We want to look at Happy New Year. Happy New Year. And then we are celebrating 3rd anniversary of the Reflection Show. And thank you for being part of our journey. I remember hey, Dr. Danny, like since we started, even when we were recording at King David and them, you were all with us. Like, you've been giving us back-to-back eye contact.
Ken David.
Yes.
Yeah.
Wow. We've done cataracts, we've done glaucoma, we've done all that. And that was my late father's doctor. Well, let's look at children. You know, I'm so passionate about kids and making sure that they can see well, because I need them to have their eyes to be able to read. But we sometimes, I don't want us to go into eye care and all that. Maybe we can go into that later. But first, what would I as a parent notice in my child, especially under 5 years old, because it starts from there, to know that these are possible symptoms of maybe I don't want to say, should I say infection or disease? Is there something like that?
Well, you can say disorders.
Okay, yeah, eye disorders. What are some of the things that parents should look out for in their children? Okay,
thank you. To start with, most of the eye problems, especially in kids, are avoidable. Now, there are 2 main types of the problems children face, right from birth through infancy, childhood, all the way to adolescence. Some of them are born with the problems, and others acquire them as they grow up. So there are some parents may not be able to detect on their own, but there are some that may manifest through the way the children act when they are playing around in the house, when they are studying, or maybe just when you shine lights on their face, how they react, or how you perceive the color of the eyes and all that. So for some children, especially the babies, let me talk of this one first. There's something we call retinoblastoma. Yes. Quite recently we had some campaign on that, because it's making some children go blind and even leading to death.
Ooh.
Yes, it's the commonest childhood cancer of the eyes.
Cancer of the eye.
Cancer of the eye, yes. We call it retinoblastoma. So with retinoblastoma, when you look at the child's eyes, the central part, which mostly looks black from outside, it looks white.
Oh.
Yes. So right when you shine light on the face of the child, you see some whites in the center of the eyes, where it's supposed to be the pupil. So you see the white reflection from there, and not like the white that comes when you take photo. That is the red eye.
Okay.
So this one, most of the time, is from one eye, sometimes from the two eyes.
Okay.
Immediately you see that, it means that the child needs attention as soon as possible. Yes. It can lead to death because it's cancerous, so it can spread in the head and affect other tissues.
And it affects babies or children more?
Yes, most often born with them.
Wow.
That aside, newborns with discharges coming from the eyes. Yes, that's why lately midwives always give you some ointment to apply to the eyes of the babies.
Okay.
Right from the first day, to prevent the infection from getting worse. Or even if there's no infection, most of the time we give it to prevent it from coming
at all.
Yeah, we call it conjunctivitis of the newborn. Yeah. From our side, we will say ophthalmia neonatorum.
I like the first one.
Yes. So those are the ones that mostly affect the babies and the infants. Growing up, you as a parent, you watch them, especially when they are watching TV, how close they get to the TV, how far they want to stay away. When they are doing their homework in the house, how close they want to get to the books. You know, some of them take the books far away from them. And then sometimes right after doing their homework, they tell you they can't see well for a while. Yes. There are some of them who come home from school complaining of severe headache almost every time. Most likely they've strained too much in school because they have vision problems.
So severe headache could, not all the time, could also be as a result of the vision problem.
Yes, it could be. It could be. In fact, a lot of times in children who read a lot, it's been found that most of the headache comes from straining to read. And sometimes they may complain of blurry vision, especially when watching TV in the house or when reading. Yeah.
And these days too, let's look at the tablets we use, the phones, the effect on the child. Because sometimes even by 3, 4, 5 years, they can even go on YouTube. And they're always on with games. If it's TV, maybe it's a bit far. But some of them want to even stand close. But with the tablets, the screen, what effect does it have on the child?
So the world is moving at a fast pace regarding technology. So this is something we cannot hold from our kids. And most of the time you realize that it gives the parents some safe time doing what they do in the house. So you just throw your tablet, your phone to the kid, and then you are going about your regular activities. Most of the time they get very close to the screen, and even with adults, you know, we have this computer vision syndrome. So with kids being exposed to that all day, all week, the months passing by, for a year, 2 years going, definitely they're constantly looking at the light from the screen, and obviously it's going to give them some problems. So there's a research which says that in the coming years, we are going to have a lot of children being short-sighted, what we call myopia.
Wow.
Yes, because they are constantly looking at stuff from close range, and throughout the day, they are not even taking time to, you know, they don't have that mindset that, oh, I've stayed too long on this computer or this pad. I should take my eyes off and look around. No. They keep looking at it, and then after some years, you realize that when things are far, they don't see them very well. That is short-sightedness. They may need glasses to see better. Yeah, so children who were not born with short-sightedness are getting that because they are constantly doing it, staring at the phone screen all day.
Okay, let's look at how often should a child's eye be examined. Let's look at from birth.
Okay. So right from birth, the first day the child's eyes are looked at. It may not be by an eye professional, but the midwife or the nurse attending to the mother or the birth
the baby
has been trained to look out for problems. So right from there, they may give you some ointment, as I said earlier. And then after, if you detect any problem, you have to bring the child to the eye clinic, because a lot of the diseases that go on in the body may manifest in the eyes.
Okay.
Most kids who get newborn jaundice are diagnosed through the eyes.
Really?
Yes. So there are a lot of children or newborns who come to the eye clinic and they have yellow eyes. Right away, we send them to the NICU. Yes, the intensive care for babies, so that they are looked at, and then labs are done to be sure that there are no substances in the blood causing the jaundice. So that aside, I think first month, 6 months, 1 year, you know, that's the kind of routine you should be taking your child through regarding eye care.
But sometimes we don't. What are some of the causes?
Most of the time.
Most times we don't. Even we, those that say that we are literate or we are learned, sometimes we don't do that. Sometimes when we come, what are usually our excuses why we don't bring our children in for early detection?
So regarding excuses, there are so many of them. We can't exhaust them here. You see, there are people who feel that so far as the child's eyes are not red, there's no problem. I saw not too long ago, I saw a child of about 5 years who had complicated retinoblastoma.
Okay.
Yes, so one side of the head had really grown big because of the tumor.
Okay.
And there's nothing they could do. They were losing the child. Yes. Even after surgery, the child did not survive. And asked why it led to that, the father said that he didn't know it was a problem. Yes. So did he attend an eye clinic? He said no. Probably because of where he stays. Fine. But then I think we need more education to go down. One, to the community nurses, two, to the parents in the communities, especially those far from areas where there are hospitals or CHIPS compound and all that. Yeah. So apart from that excuse, there are people who say that they were advised that if you put breast milk on it, it will be better. So they kept doing it and it got worsened. On
the eye?
Yes.
You put breast milk on the eye?
Yes, that's what a lot of them do. And
I'm trying to see the connection of breast milk to the eye.
Yes. As much as you find it, I don't want to say annoying, but yeah, you don't want to also sound that way so the patient doesn't come back.
Yeah.
Because you want to make them keep coming so that you take care of them the best way possible. So it's a problem. They keep happening. Yes.
Early detection. Yeah, you've mentioned some of the importance of or the reasons why it's good to do. Are there others that you think that parents or I don't like saying mothers, but parents, but parents, of course, our mothers are usually very close to us and they can detect. But why do you think it's very important for parents to take their kids to the hospital to make sure that they are detected very early?
Yes, so depending on how serious the case is, if you do not take the child to the hospital early, as I said earlier, you may lose the child. If you are lucky and the white stain we see in the center of the eyes is cataracts, fine. After surgery, the child gets to see better. Now, if it's some infection, it may cause problem to the cornea. That's what we see as black from outside, the bigger one. If the infection spreads to that side, it may cause some ulcer, or we say sore, which may lead to scars and make the child blind.
Yeah.
So it's always important that when you see things like redness, tears coming from the child's eyes, the child going too close to television to watch, bringing books or phones too close to the eyes, it's important that you quickly take the child to the eye clinic, let the professionals look at it, and then tell you to relax. There's no problem. It's better than you staying at home and then you come later to be told that there's nothing we can do about it. Yes. Yeah. From the stats, it's documented that about 5 to 10% of the blindness recorded is for children.
Okay.
Yes, from childhood actually. So they may have grown up with it, and then they are counted as blind people when they are old. And most of them are from corneal scars.
Okay.
When we say corneal scars, good. So when you look at this, the front part here, which is transparent.
Okay, let me move the flower.
So the front part here, which is transparent, is the cornea. Yes, it's very sensitive. So when there's injury to the eye, that's the part that we fear so much that it may get sore.
Okay.
When there's sore to that part and it is not attended to early, it may lead to a scar. And the scar, you see it's transparent.
Yeah.
So if there's a scar, the scar is most likely going to be white.
Okay.
So it means it blocks light from going into the eyes and the person is blind. Once there's no light going into the eyes, the person cannot see. Yes. So there are a lot of children with corneal scars, and because of that, they don't see. And it's all through injury. Sometimes very mild something fell in the eye.
Hey, I remember there was a time I was riding my bike and some insects fell in my eye. And I don't know, it was pepperish. It was painful.
Yes.
I put a lot of water. Sometimes even once the insect is even out, you still feel the pain.
Yes.
Can those things cause any eye problem or disorder?
Yes, it can cause the worst problem. It can make you blind.
The insects that...
Yes, just an insect entering your eye.
Hey.
It can actually make you blind.
Hey, I have to come and check my eyes. I haven't checked my eyes in a while.
Yeah, so that thing staying under your eyelid can be rubbing on top of the cornea. And before you know, it's causing some sore. Sometimes you might have gotten rid of the insect entirely, even with the wings or any particle that followed it. There may be nothing in the eye at the time, but because when it got there, it's rubbed the surface of the cornea, or maybe some chemicals from the insects were left inside the eye. It causes sore to the front part, which is the cornea, and then if not taken care of, can affect the inner tissues of the cornea, leading to blindness. Yes. So if the sore goes deeper on the cornea, it may most likely lead to blindness. The sore will go, but the scar left will not help you to see. Now
let's look at eye care and eye screening. When we talk about screening, what does it mean? Sometimes people think that the screening, I'm going to check my eyes and so that it's okay. But what is the difference? And after an eye screening, what is the next thing that must be done?
Yes. So mostly the screening is targeted it's targeted at looking out for, certain eye conditions. So for instance, we want to look out for the people who have cataracts in this area. So we call everybody here to do screening. When we are doing the screening, we are looking out for cataracts, but we might find other problems of concern. So we refer those people to come for follow-up so that we do proper examination. When we are screening, there are a lot of machines in our clinic. We cannot move them out, but they are needed for comprehensive examination. So if we are doing some screening at a place and you come there, the best we can do is to check how well you see from far, how well you see near, and then do what we call the fundoscopy or ophthalmoscopy. You see the lights we used to look inside your eyes. Yes. So we look inside your eyes, look at the back, see if the nerves look okay, the veins look okay. then we can say, oh, you are fine. But if there's some nerve damage that have started slowly, we may not be able to tell at a screening grounds.
Okay.
Unless you come to our clinic and then we do some scans. Maybe we do an OCT to see what the naked eyes don't see.
Yeah. Yeah.
So there may be people who are also straining to see, but on screening grounds, they can read everything on our charts. Yeah. But they still have a lot of headache.
Some of us told us we couldn't see the thing, so we can get, when we're in school, so we can get specs.
No, but I mean, a doctor will catch you.
Yeah, a doctor will catch you. Right?
Just that the children waste their time on those things so much.
Yeah.
Some of them lie. They want to wear glasses.
They want to wear the specs, so they'll be like, is it here or here? They'll be like, is it here? And then they'll say it's up.
You know, he sees an A.
Yes. So
you point to an A and he says C. So you go around and come back to the A. He forgets himself and say A. You go and then come back. And then he says, he pretends not to see it. And then he says, why?
Yeah.
Oh, the kids, some of them are very smart.
Yeah, so they want to. I remember there was this joke that someone said that a medical student who wanted to be an eye specialist told the father that thing there, you have some torchlights.
That's your ophthalmoscope.
I don't know the name. And the father said, how? Just thought what and bought normal torchlight for the son. And the son said, it's not this torchlight. He said, no, the son wants to spend their money. So people had to come and convince the father that the torchlight they need in the hospital is not the normal one. Yeah, but your things are really expensive. We usually use it to
very expensive. So eye care should be expensive. But well, we've relaxed it.
I know, right?
Yeah. We're trying to help. We are trying to help. So sometimes if you want to put everything in there, it's going to be very expensive. And the very people who really need the care may not be able to access it. So by way of spreading the cost, you know, we try to soften it for certain people. That's why we've brought up so many packages, especially our clinic, so that certain vulnerable people groups can be able to access the service. Otherwise, before you know, certain people are blind from things that could have easily been avoided.
So now at the screening ground, let's look at what should the patient know, especially if you are taking your child to the clinic, because when we had our eye screening, I was shocked to see that most of the kids were coming alone. We had announced that we're to organize a free eye screening for the kids at the reading clinic. And I got here and I'm seeing a lot of children. I'm like, where are the parents? And one of your team said that when you tell them, take this eye drop one morning, all they just do is yes. But once they come out, so we asked one of them, what did the doctor say? They can't remember.
He can't remember.
So what should the patient, let's start from the kids even to the adults, know before they go, even whether it's to the screening center or even to the hospital for a proper checkup?
Yes, so if it's screening grounds, yes, we are doing screening. But if there's the need for a follow-up, that's why it's important that parents come with the kids. Because if the children came alone and there's an important message you want to pass to their parents, where are they? Sometimes you write for them and they play on their way. Before they get home, the paper is missing. So we don't get to see those referral cases at the clinics. So if the parents came with them, you could directly tell them, this is what your child needs. So kindly bring them to our clinic for further examination, maybe next week, next 2 weeks. And then they know it's registered. Even if they forget, one day they'll remember. But the kids cannot carry that information home. So a lot of time we get that problem. For adults, when you are coming for eye screening, you should know that it is not a comprehensive examination. Because we can't do that, especially in an open space like that. And there are a lot of machines we use that we cannot carry to that place. So if you come to a screening ground and then we tell you that, oh, we suspect you have this problem, please come for further examination. It's important. That's why we ask you to come. Sometimes you even tell them, because you were at this screening grounds, in a way, you know, we may be tilted to the thinking that maybe you couldn't afford walking into a private clinic to check your eyes. That's why you waited for a screening period. So come there, we are not going to charge you for the follow-up examination. Yet people don't turn up.
Wow.
Yes. So people don't turn up, and then eventually, if you are lucky to remember some of their faces, after 5 years, some show up with very bad conditions. Most often not reversible.
Wow.
Which is very bad.
That could have been prevented 5 years, 3 years ago.
Yes. Yes. According to our statistics, over 70% of eye problems are avoidable.
Wow.
Yes.
But there are some who are just born blind. Is it that something usually happened during the pregnancy or what?
Yes. So a lot of things go on. Hormonal changes, a lot of DNA mix-up and all that. So genetic constitution and all that from the backgrounds of both parents, it's sometimes lead to babies developing certain conditions even before they are born, like cataracts, like this retinoblastoma I talked about. Some children are even born with very small eyes that do not see. Okay. Yes. And there's nothing we can do about it.
Is it the Chinese eyes that they are trying to train their eyes and they can't see? Or is it very small eyes?
So not the eyelids, but the eyeballs themselves
are very small.
They are micro. Yes. And there are children who are born with, especially those that lacked oxygen, or those that were preterm and the oxygen they were given was too much, you know, some poor constitution and all that can lead to retinopathy of prematurity. So because of poor, you know, growth in the eyes, sometimes it leads to poor formation of some of the cells and tissues in the eyes. So those children are born with very poor vision or blind. And there's nothing we can do about it.
It's
That's how they were born.
Birth.
Yes. Yes. I think the ones that we can do something about are the cataract, which surgery can reverse, the refractive errors, which glasses makes the child sees better. Sometimes the strabismus, which is the crossed eyes. So the children with both eyes looking this way or divergent, looking outward.
So is it those when they are looking at you, it looks like they're looking somewhere? Those,
Yes.
Okay.
So we say
what causes that?
So there are problems from either muscle weakness. Okay. There are 6 muscles that control the movement of each eye. And they work together. So if the muscles from this side are moving the eyes to this way, this one also moves this way. And they are represented by these red things on the globe. Yeah. So they move the eyes in different directions. If any of them has any weakness, it shows in the eye position. Yes. So if the eye muscle that should move the eye this way is weak, it means it can't hold the eye in position. It's weak, so it makes the eye move this way. It could also be from the nerves that control the muscle movement. So the muscles in our bodies are controlled by the nerves. So if there's some prick here with a pin, the nerves, you feel it through the nerves.
Yes.
And the muscles, it tells the muscles that there's some danger here, move this way. That's how come your hand moves involuntarily.
Yeah, that's
without
true.
thinking of it. Yes. So in the eyes, certain things, the nerves that control the movement of the eyes can have problems. And it will affect the muscles that control the movement and obviously make the eye turn some way. So that eye may be looking outward or inward, and it will affect the movements. Some of these kids with such conditions may have double vision, which can bring a lot of problems. You know, you look at something and then it appears 2. Sometimes you get close and it's 1. You go back, they are 2. So we have to find a way to make them fuse together as one. Ideally, it's the work of the brain, naturally.
to
but
be able to direct.
Yes,
Yeah.
since
Okay.
the eyes are not, aligned, it's difficult for the person to have that fusional mechanism working
Okay.
well.
Okay. I want to take a break. We'll be right back.
My name is Naima. I have a challenge with my eye since I was in basic 5. If I'm in class learning on the board, it reflects. So I can't see well, I can't read well, so I have a problem with learning. So when I heard about the eye screen in Matter Research Foundation, I decided to come over and see how it will help me, and I'm very happy to be here today.
Welcome back from the break. We are looking at how we can all make sure that our children are very strong and healthy, because our eyes, like, the eyes are everything. If you can't see, basically it's like you are shut down on whatever is happening in the world. But we cannot have kids that are growing healthy in other ways, but through their eyes they cannot see. No. So, doctor, I want us to look at some surgeries on that perspective. Is there a way they can do some surgeries to correct the nerves that are seen at different directions when you actually mean to be seeing somewhere?
Yes. So when it comes to the crossed eyes or strabismus, there are different therapies that can be done. So one of the remedies is glasses. So the optometrist will do some examination to see what is causing the deviation. We call it deviation because instead of being aligned this way, maybe one is deviated outward or inward, or maybe they are crossed. So in certain circumstances, glasses may help, especially for the kids. So when they are growing up, it helps them slowly for the eyes to align, especially if they have certain conditions that blur the vision or causes them to have double vision. That way the glasses would help. And then there are some parts of the glasses we call prisms. They also help to align the vision or the images the children are seeing, so they do not have double vision. When they grow to certain points, or even as they are young, at certain times, there's nothing we can do about it, especially regarding glasses. So unless they do surgery to align the muscles. So the muscles could be, so that at times the muscles may even be too long. Naturally, that's how they were born. So there are specialists that do that, neuro-ophthalmologists. They do some surgery to resection them. Sometimes they shorten some muscles to align the eyes well, so they can see the way they should. And after that, they may go through some reviews before they begin to see very well the way they should. Yes. So there are times also that leads to something we call amblyopia. Yes. So amblyopia is the fact that there's naturally or physiologically nothing wrong with the eyes. You look into the eyes, everything looks fine. You check, but the vision is not fine. We give glasses, but the vision doesn't improve. Yes. So we say the eyes have become lazy. Yes. So lazy in the sense that there's no problem there, but they are not seeing. We call it amblyopia.
And those ones, glasses is not helping, eye drops are not helping, nothing. Surgery is not helping.
Yes.
The eye just wants to be left to be lazy.
Yeah. So there are a lot of causes of lazy eyes or amblyopia. It could be that the child was born with some condition that was not taken care of early enough to provide the child with good vision. There's something we say about children's eyesight. We say that children learn to see by seeing. It means that if you are not seeing, the eyes are not developing well. So if a child is born, and for instance, you keep the child in a dark room for years, he comes out and will not see because the eyes were not exposed to light to be able to learn how to see. The same way, if there's a corneal ulcer or there's cataract, which blocks light from entering the eyes, for a long time, if it's not taken care of early in life, the child gets to a level and then you take it out, the vision is impaired because the back of the eyes were not exposed to light early enough. So at that point, the child becomes amblyopic and is now going to start learning how to see. It takes time.
Yeah. So now let's look at what can parents do to prioritize the eye care of their children. Despite our busy schedules, what can we really do to prioritize the eye care?
Yeah. So we've talked about certain routine eye checks. It's very important that right from birth, you make a conscious effort, not only because you have seen some discharges or the child is tearing up or you've seen some white in the eyes. In simple terms, even if you are not coming to the hospital, the black of the eye should be black.
Okay.
The white of the eyes should be white.
Okay.
When we talk of the whites, we mean the parts surrounding what we see as white in the eyes.
Okay, in the eye. Okay.
Yes. What we call conjunctiva. It should be white. If there's any stain of black, of red,
or something different than the usual black and white, it's a cause for alarm. But sometimes we put these things, I don't know how they call it.
Contact lens.
Maybe that's the name. They put it on the eye, on the black.
And it looks different.
And it looks different. And some say that it's also a way to protect the eye.
No, that's fine. That's cosmesis. But then the contact lenses are supposed to improve your vision.
Is it good for children?
Outside, children use contact lenses.
Okay.
But up to a certain age.
Okay.
I mean, it starts from a certain age. But in our environment, we do not advise children to use contact lenses. Yes. Even with adults, we restrict certain people from using contact lenses. So that is another issue altogether. Yes, and it doesn't protect the eyes. It can rather predispose you to getting certain infections.
Because of even the way it is kept.
Yes. Even how you place it on the eyes.
Because I'm told you have to remove it every night.
Yes.
There
are some that are extended were fine, but a lot of them you have to remove them before you go to sleep.
So what you want to sleep in the afternoon, you have to remove it.
You should take it off.
Then we can't wear, because otherwise that you just be tired, you lie down, you start sleeping. Then you can't wear that. Then let's look at the glasses. Some of them are very thick. So the glasses, there are some of them that are thick. Some are light. Sometimes I took someone's glasses and I couldn't see anything. I was like, how is he wearing that thing? And I saw a young girl, she's less than 10 years old, and hers was very thick. What makes one has thick or light specs, and what goes into it? And for children, is there a risk not that they'll break it? Because even adults break their lenses.
Yeah. So regarding the dynamics of the glasses, it's relative, to your refractive error. So the refractive error is what makes you need the glasses to see well. It means that you are not seeing well, or even if you are seeing well, you are not comfortable with the kind of vision you have, especially for people who see well and still get headache. We give them the glasses. Now, some of them, the refractive error is so high that the prescription is also very high. So it makes the lens thick. There are new technologies that are meant to make the lenses appear thin, as if your eye problem is very low. But for some people's refractive errors, they are so high that no matter how much you reduce the thickness, it still looks thick.
Okay.
Yes. So the magnitude of the refractive error could be -1, -2, -3. And you see people having as high as -20 or +20. That is obviously going to look very thick, like the base of a bottle.
Wow.
Yes. Sometimes, no matter how much technology...
Are they able to see clearly?
Yeah, they see very well with them on. You might think that once you take it and you don't see anything, they have the same issue.
Yeah.
No. Once they wear it, they are seen as well as you do without any glasses. So depending on the kind of refractive error, we give the glasses that suits them and make them see comfortably well.
Okay.
Yes. So some of them can be very thin, and then some can be very thick.
Okay.
Yes. There are some of them we have to produce outside the country because
we don't have the resources to produce
it's
in
too
Ghana.
high. Yeah. So those are the dynamics when it comes to the glasses. Yeah.
And sometimes when you look at the children, how do they keep? Because sometimes I easily break my glass, even the ones I wear because of the sun and other things. But how are they able to keep it?
There are certain frames we give to children.
Okay.
You know, with the glasses, this is the frame.
Okay.
And then this is the medicated lens.
Okay.
So when it comes to children, there are certain frames we give to them. Some are very flexible.
Okay.
So you can open it up, pull it, even try to break it. It will not break.
Yeah, I think that's
because it's very flexible.
Yeah.
Some of them, they feel like very soft, like gum.
Okay.
Like chewing gum. Very soft.
But it is the what's the name? The medication.
Lens, yes, the lens that matters most. So they may get scratched, yes, but the frame would still be strong.
Okay, yeah.
So there are certain materials also we do not use for kids.
Okay.
So depending on the age of the child, there are certain frames and lenses we do not give them. So some of them also, because they misplace them so easily, that's why we hang the ropes around them. So the glasses, even when it drops, it's hanging.
Yeah. Yeah.
So when it comes to children with their glasses, there are so many things we do to make sure that you know, they do not waste their parents' money.
Yeah, that's true. We used to think those who wear glasses in school were the very intelligent ones.
A lot of them are.
Yes, a lot of them are, but it doesn't mean that we those who don't wear are not intelligent. You know, there was this thing around it that looked like if you wear glasses, you are too intelligent. No. Let's look at eye drops. We see a lot of eye drops in the market. You just walk into the pharmacy and they say, oh, my eye is itchy, this they give you. What goes into recommended eye drops, and at what stage shouldn't a child use eye drop, or eye drop shouldn't be used? Like, let's look at eye drop, because I see that eye drops are, should I say, abused.
Yeah.
They are really abused.
Very much, yeah.
And every parent will just go and say, oh, my child is this. And once they're over the counter, or even if it's a pharmacy, sometimes you can be lucky, because some people would actually want to know what the challenge is. But if it's just walking, oh, my brother's child eye was itching and bought this drug, I should also go and buy some. What can we see about eye drops, and also encouraging parents to be careful of just giving any eye drop to their child?
Okay, so regarding eye drops, they are prescription medications. There are drops that can be bought over the counter, meaning you can buy them without prescription. So those over the counter drops, they are same everywhere, especially with the artificial tears. The artificial tears should be, or I believe they are supposed to be formulated like the natural tears.
Okay.
So people with something we call dry eyes, they put it in their eyes and they get some relief. So it works like the natural tears to wet the eyes and all that. We have some eye wash and all that. They are over-the-counter drops. But the antibiotics, like the gentamicin, ciprofloxacin, chloramphenicol, they are all prescription drugs. There are even some of them that are more complicated. We call them steroid eye drops.
Okay.
They are not supposed to be given without medication, without prescription, sorry. So if you are fond of always giving any eye drop to your child because they have a condition you think needs that particular eye drop, or somebody else has used the same drop for a similar condition, you are endangering your child's eyes. Yes, because it might get to a point where the eyes gain that resistance, or those kind of infections get that resistance. Even if initially they were helping you, it gets to a point you use those drops and they don't work. We have to get higher levels of those drops, you know. So it's advisable that you always get the eyes examined, so that the drugs will be recommended. Yes.
Medication.
Yes. I must say a lot of pharmacies are doing very well. You know, we get referrals from some of them.
Great.
People come and they are like, oh, they went to the pharmacy shop and they were advised to come for examination before. Yes.
Yeah.
So that really helps. Yes. I've seen people use wrong medications and they lose their eyes forever.
Wow. Especially the eye drop.
Yes, it happens a lot. Yes, eye drops, I mean.
Yeah.
Yes. Yeah. So it's very wrong that you used an eye drop earlier and then you put it on the shelf for the next problem you encounter or for somebody else. It doesn't help. Yes.
So once you use, whether it's finished or not, you have to discard it.
Yes, once you've done the period for which it was given, you discard it.
Okay.
Yes. If you are keeping it, I don't know for what, maybe for some future reference, but it shouldn't be reused.
Okay.
For any reason.
Especially, even though it's not expired, it shouldn't be reused once you open it.
It's you've used it for the reason. Okay.
So there could be another reason that is not the reason why they gave you the first medication.
Yes. So you shouldn't go back to it.
Okay.
Yeah.
I think that
if you were given for 2 weeks, once the 2 weeks is done, and you do your review and you are fine, you put it aside. You don't need it anymore. I unless you are told to continue using it. There are drops like that. There are people who have chronic conditions like glaucoma. They need those medications for a long term. I mean, they are on medication for the rest of their lives. Yes. Children also do get glaucoma.
Oh my goodness.
Yeah, we have a condition called ophthalmos. Some children are born with already high eye pressure, which predisposes them to getting glaucoma. So such children would need immediate examination and then medications or even surgery to reduce the pressure, so it doesn't lead to glaucoma.
Okay. We are running behind time. Give us your final words on this, and especially on parents, because they are usually those that are paying attention to their kids, what they must know so that their kids do not lose their eyesight at all.
Okay, so I would say that parents should never watch their kids play with sharp objects in the house. Not just sharp objects, but you see children playing with sticks around, and that's how they get hit. And I believe that is the reason why corneal scars are more prevalent when it comes to children with blindness. Later, the children will they'll grow up to blame you. You shouldn't wait till a child's eye condition is very bad before they visit the clinic.
Hospital.
Yes. The moment you notice red eyes or the child tearing up, quickly bring the child to the eye clinic. Let us look at it.
Or continuous headaches.
They're reporting headache all the time. It has to be looked at. Children going very close to their television sets or bringing their phones or tablets too close to the eyes, they need to be examined. Most likely they have a refractive error. Yes. You know, there may be things I left out, but generally, we should try as much as possible to check the eyes once every year at least. Yes. Even with the children who appear not to have any problem, let us check their eyes once every year. So if there's any problem coming up,
you will notice it very early.
Very early.
All right. Thank you so much, Doc. I think that this has really opened our eyes to, sometimes we don't really pay attention to the eyes of our kids. Unless something is really wrong, we don't really pay so much attention to that. Sorry, I have been speaking with Dr. Daniel Opoku Gyamfi. He is a principal optometrist at the Savannah Opticals and Eye Care here in Tamale. And Yendi as well. Yes. You have a branch in Yendi. So if you are in Tamale or Yendi, please go to the Savannah Opticals because they are the best eye care you can ever find. And I hope you have a lot of branches. Of course, you are the best. Because you keep hearing Savannah Opticals. Anyone that I know that have come to you has really said very good things about Savannah Opticals. And I heard about Savannah Opticals from my boss, YAD. Anytime when I used to be on radio, every morning he would mention Savannah Opticals, and I was like, okay, Savannah Opticals. Indeed, you are helping the Savannah to make sure that we can see brighter, we can see better, and we can see the whole world at large. Thank you so much for watching. I'm Martha Inspires. To have a good night.